talk about what plans exist. Understanding the differences between plans like out-of-pocket costs and which doctors you can see will ultimately help you choose the plan that works best for you and your family. At first, this all might sound like alphabet soup, but don't worry, I'll guide you along the way. Here are the most common types of health insurance plans. First, we have health maintenance organizations, or HMOs. These plans require you to choose a primary care physician, or PCP, in their network, which is the provider you will see for any health-related issues besides emergencies. If your PCP is unable to treat the issue, they will refer you to a specialist in your network. HMOs generally have the lowest premiums and out-of-pocket costs, but are more restrictive than other types of plans. If you choose to see a doctor outside of your network, payment is not covered by your plan. Next, let's talk about preferred provider organizations, or PPOs. Similar to HMOs, PPOs also have a network of physicians but are more flexible. For instance, if you see an in-network doctor, your copay is lower and the percentage of the service that the company covers is greater. But if you choose to see an out-of-network doctor, a smaller percentage of the costs will be covered and you'll likely have higher out-of-pocket costs. Also, a big difference in this plan is that you are not required to obtain a referral from a PCP to see a specialist. There are also exclusive provider organizations, or EPOs. An EPO is like a hybrid of an HMO and PPO. EPOs tend to offer more flexibility than an HMO and tend to cost less than a PPO. EPOs do not require referrals for specialists, but you are responsible for paying out of pocket if you seek care outside of your network. And finally, we have point-of-service plans, or POSs. POS plans also resemble a mixture of HMOs and PPOs. Like an HMO, you are required to obtain a referral from your PCP in order to see a specialist. And like a PPO, you will pay less if you use in-network doctors, but will still have access to out-of-network providers at an increased cost. Let's move on from plans and talk about some key players and important terms.